I'd like to call the meeting to order. Board of Leavenworth County Commissioners. I'd like to invite everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to begin with a moment of silence, please. Roll call, start with Commissioner Culberson.
Here.
Commissioner Smith is present. Commissioner Stevens.
Here.
Commissioner Cos.
Here.
And Commissioner Shimke.
Here.
All right, all commissioners are present in some form. We have public comment. We have someone calling in.
You gotta call them.
Okay, could you call them?
Sure.
Thank you.
Hello.
Miss Ladurn,
Yes.
this is Becky with the County Commissioner's Office. We are ready for your public comment.
Do I start right now?
Yeah, go ahead.
Go ahead.
Good morning, Commissioners. My name is Jessica Ladurn, and I live at 811 Potawatomi Street. I am commenting today to question your decision to lift a mask order for our county. In my opinion, with all other factual evidence aside, you have polarized our community with this decision. In my experience here recently, I've been verbally harassed in both my personal life and my place of work, simply because I wear a mask. You have divided our county into two warring factions of proponents of masks and those who believe it infringes on their personal rights. The ironic thing about this situation is that mask wearing is a public safety concern and not that of any citizen's personal rights. Public safety refers to situations like seatbelts and moving vehicles, public drunkenness, and banning firearms on school property. We don't have these laws and ordinances to infringe upon anyone's rights. We have them to make our community safer as a whole. Peer-reviewed medical studies all over the planet say that mask wearing will slow the spread of COVID-19, causing less people to fall ill at all. Mask wearing is incredibly simple and cost-effective, and a tool that could prevent Leavenworth County from becoming a hot spot for this virus. When you think about Leavenworth County and mask wearing, are you considering at all what makes our county unique? We have a population of over 60,000 people, with a huge percentage of that commuting to one of the biggest metro areas in the region or working in one of our many prisons daily. I also want to know why we are evaluating this entire situation by comparing the number of infected to our overall population. Hotspots in this country have been created on a dime, and the edge of Kansas City is only 30 minutes away. Our location alone makes those numbers useless, because if a hotspot situation happened in Kansas City, we are so close that we will go down with that ship. Fall and winter are coming, and people will congregate indoors more often. Why risk it? If you could prevent the worst, why wouldn't you? Why wait until enough people are affected to act when you can act right now? Commissioners, thank you for your time.
Thank you.
This is Chuck.
Mr. Irwin, this is Becky with the County Commissioner's Office. We are ready for your public comment.
Sure. And I'll keep it brief. I'd just like to say, first of all, good morning to you all. I sat down with my family of 7, and we discussed the mandatory of wearing face mask, and we came to the conclusion that we are...
Could you state your name for the record real quick?
Charles Irwin. Irwin spelled Urwin.
Thank you.
I'm sorry. Did you get what I said earlier?
Okay, go ahead.
We came to the conclusion that we are all definitely against the mandatory face mask order. I won't go into, I'll keep it brief. I'll just say it would be helpful if, before you vote on this, that you read an article that I read online from on face mask by BMJ.com. That's Bravo Mike Juliet.com on wearing face mask. I found it to be very helpful, giving all the information so we can make an informed decision. But we are against a mandatory order to wear a face mask. And that's all I have.
Okay. Thank you.
Thank you for calling.
Thank you very much. Bye-bye.
That is for public comment. All right, we'll close the public comment portion of our meeting and move on to administrative business. Mr. Lawford, is there any administrative business?
Yeah, one primary topic, but a couple of items that I wanted to go over with the board today. The first one being the CARES Act Relief Committee, I guess I'll call them, had met. We went over some topics. One of the things that we decided would be important is that the commission have a policy that discusses how the funds will be spent and also how they will be distributed. And then also I have circulated for you today, it's more of a frequently asked question, but it's details for the entities who would be eligible to receive funds from the county on who is eligible, how they go about making application, and then when and how the funds would be distributed. I tried to make a separate section for each of the groups that we've identified that the county would be setting aside CARES Act relief funds for. The policy I would like for the board to consider and approve today. The distribution details is, like I said, it's more of a kind of a frequently asked question thing, so you don't have to vote on that. But if you have any questions about it or would like to see anything added to it, I would definitely like to have that input before I circulate this out to any of the entities who are interested in funds.
I had a clarification, just because I've gotten a few questions on this.
Sure.
Is the townships and Easton and Linwood, can you clarify to people where they fit into the application process?
They would fall under the other taxing entities.
Okay, that was a question that came up.
Any other questions? Has there been any concerns that we're just not passing it through to the cities, that we've got to make sure it's spent properly?
Well, I mean, I think we've discussed that internally on the best way to, one, protect the county from any potential exposure, which I mean, I think everybody wants to play by the rules. I don't foresee that they won't. But if there's a misinterpretation, we're on the hook for it. So I think it's best if we have the ability to approve the expenditures as we go versus after the fact when the money's already gone. So that the committee also agreed that would be the appropriate process. So that's why it's a reimbursement basis. Or they can submit invoices directly to us and we can pay vendors directly for them if they would like. Either way, we'll work with them on that. But especially some of the smaller entities, I think that's important for. Now, the outside agencies that are from the human services fields, those are grants, so the expenditure process is a little bit different for them. They don't have to provide an accounting back to us on those funds. They just have to make an application explaining why they need the funds. So a little different for them, but the other entities it would be reimbursement.
All right. Any other questions? Anyone have anything else to add to that, or any concerns with the document?
I would like to express appreciation to Mark for all the hard work he went to get this put together. It was
I agree.
a lot of effort.
And it's just beginning.
Well, the state's still conducting like 2 conferences, web conferences a week, trying to explain, and it seems like each week they kind of come out with some different guidance, which is also what makes me a little bit concerned about just releasing the funds, because they may change their guidance on something, and if we're submitting it to them, they are approving, the state's accepting it as we go, versus after the fact we say, oops, that doesn't meet your new guidance type thing. So,
and that'd be the ideal situation if we just passed it through to the cities on other entities, but we have to protect ourselves because, like I said, the county would have to pay back any funds if they weren't spent properly.
And either way, we have to upload the expenditures into the state's website, so they have to provide us this detail anyways. It's not, this doesn't add additional work for them. They have to provide this information to us anyways, and then we have to upload it to the state.
Okay.
And Mark, we had talked about maybe putting together just a short informational email that we could send to like fire districts.
Yep, and that's what I prepared this for. After we had discussed that, I was working on this, but I put some additional detail in here for the outside other taxing entities that kind of explains all that.
Yeah,
so.
Perfect.
And the deadline is the 3rd of August, is that right? Or
the spending plan for the taxing entities, the big taxing entities, the school districts and the 4 main large cities, their spending plan has to come back to us by August 6th. So that we can submit it to the state on August 15th. And then any of their expenditures have to fall within that spending plan. The other entities don't have to submit a spending plan. They're part of our spending plan. So would they just have to submit throughout the process, they have to submit their invoices for reimbursement. October 1st, I believe, October 1st is the date I put for them to have their last invoices to us, because by November 20th, we would need to have everything paid, and then we could reallocate if there were any funds left over. If we go much past that date, we won't have a chance to use those funds before the end of the year, and by December 30th, we have to have everything to the state that we've spent for the year. And they're asking in mid-November for us to have all these funds accounted for. Otherwise, they want the money back.
Okay.
So that's what the frequently asked questions, that kind of explains that, I think, to the point.
Is everybody good with this document going out? Okay. You don't need a motion on that.
I don't. On the policy, I do need the board to approve that policy if they would.
The CARES Act funding?
Yeah, I'll entertain a motion to approve the CARES Act funding policy.
So moved.
Second. Commissioner Cos.
Have a motion and a second. Any further discussion on the CARES Act funding policy? Voting.
Aye.
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 Commissioner Cos votes aye.
Commissioner Shimsky votes aye.
All right. Thank you. Okay. Is there any other administrative business?
Those were the items I wanted to cover today.
Okay. We'll move on to the consent agendas. Commissioners had a chance to look at everything. Does anything need to be pulled from the consent agenda and voted on separately?
I did have an amendment to the minutes. There was a statement I gave the opposition golden rules, and I'm just going to insert that statement.
Okay. All right. Any other corrections? I'll entertain a motion to approve the consent agenda.
So moved.
Second.
Have a motion and a second. Any further discussion on the consent agenda? Voting?
Aye.
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 Commissioner Cos votes aye.
Commissioner Shimsky votes aye.
All right. Thank you. Okay. We ready for community corrections? Rhonda, how are you today?
Thank
Morning.
you. Commissioner Smith for always wearing purple in the days that I'm here. They stay proud.
Yeah.
Good morning, Commissioners.
Morning.
This morning, what I've brought forward to you is a budget line adjustment for the juvenile budget for fiscal year 2020. As you recall, our fiscal year runs from July 1st to June 30th. And the juvenile grant is for the 1st Judicial District, which is Leavenworth and Atchison County. The majority of the line item adjustments, which basically means we moved budget from one line item to another to cover that cost, tends to be in the personnel section. And the reasoning for that, for Leavenworth County, I can tell you, was largely part to the generous COLA increase that the commissioners voted for personnel. We had not budgeted that much, and so we took it from another area, but we appreciated that increased COLA. The intake and assessment department, which is the JDC, is due to a buyback of leave of one of their staff. Atchison County reported an increased cost of a cell phone reimbursement. They purchased a new copier, and a new vehicle that they purchased was budgeted less than the newer state allotment amount was. So, in summary, Leavenworth County adjusted $32,492. The intake and assessment department, $15,390.16, and Atchison County, $3,368. That's a total of $51,250.16. If any adjustment is over $5,000, the state does require Board of County Commissioners' signature on that. So I'm asking for a signature on the budget adjustment so that we can submit the final budget report for fiscal year 20. It's due next week, July 31st. That's what I'm asking today. The good news is that we did not have to request any funds come from the county, so we stayed within our state budget.
Okay. Commissioners have any questions, Rhonda, on this? Just a formality, basically. If not, I'll entertain a motion to approve the budget line item adjustments for the end of 2020.
So moved.
Second.
Have a motion and a second. Any further discussion? Voting?
Aye.
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 Commissioner Cost votes aye.
Commissioner Shinn votes aye.
You got an official one for me to sign, or did I sign
Sure
this
do.
one?
Thank you very much.
Oh, you got another one? Yeah, I'll just sign both. Because I probably got some notes on it. You wouldn't want to see them. Thank you, Rhonda. All right. Ready for the sheriff. How are you today, Sheriff?
I'm doing well, thank you. How are you?
Good.
So this morning I bring to you for consideration the signing of an interlocal agreement between the County of Leavenworth and the City of Leavenworth. This is an agreement on a Edward Burr Memorial Justice Assistant Grant. It is a grant that these two entities have participated in jointly for several years. And essentially the amount of the grant is divided between the City of Leavenworth, the Police Department, and the Leavenworth County Sheriff's Office on a 60-40% split. The award this year is in the amount of $24,384. And so roughly the 60% would equate to $14,384 going to the City of Leavenworth and $10,000 going to the Leavenworth County Sheriff's Office. There is an agreement that they request to be signed by the chairman of the board and the county administrator.
Any questions of the sheriff on this free money? It's a grant. We could sign grants all day long, and we'd be better off. Any questions, Commissioner Culberson?
Nope. Good job.
I'll entertain a motion to authorize chairman to sign this grant.
So moved.
Second.
Have a motion and a second. Any further discussion? Voting?
Vote. Aye.
Aye.
Get it out.
It's the mask.
Commissioner Costos, aye.
Commissioner Jim votes aye.
Two. Oh, more. Just one signature.
Yep.
Make sure.
Thanks.
We're ready for Public Works. Mr. Knoll, how are you today?
Good. How are you doing?
Good.
All right. Today, for your consideration, we have two board action items. The first of which is a contract for preliminary engineering for the replacement of SH-22. From the selection committee, no general consensus was reached regarding the proposals received. There were three firms that had adequate proposals and were qualified to design the project. Secondary to that, the discussion was had and a consensus is reached to reach out to these firms and get a cost estimate for the design of these projects. From that, Finney and Turnipseed was selected to design the bridge structure for SH-22. And so today, for your consideration, to answer any questions you may have, we have a contract for that design that would need to be signed by the chairman.
Any questions on that?
Well, Bill, I just wanted you to, as part of that committee, can you just tell the folks what the alternative design costs were that were proposed for the other?
Yes. So we solicited for three design costs from GBA and from Trans Systems and from Finney and Turnipseed. Finney and Turnipseed's design cost were $72,000 for the project. GBA's was approximately $240,000, and Trans Systems was $270,000. Both GBA's proposal had multiple exclusions from that cost estimate, so they would require that to be revised, which would have increased that $240,000 cost. So the other two proposals that we did receive were 300% bigger, 3 times as much for the same design.
So we're saving the county over $200,000.
Yeah, we're going to save about $200,000. Yeah.
Right.
Yeah.
It's a big deal.
Good
That could
savings.
go toward the bridge.
Yeah, the bridge. That might be as much as 25 to 30% of the cost of the construction of the bridge. That's a significant cost difference. One of the main factors may be experience. I don't know. Or maybe the team that was being put together as a part of the proposal to do the design, but I know one firm that was one of the higher price firms had estimated that the design would take 1,500 hours, where Finney and Turnipseed had estimated that their design would take 750 hours. So that, in conjunction with the overhead multipliers of some of the larger firms, is what created the significant difference.
I would like to just point out that in the selection process, the first thing that the staff did, Bill and with the Olson, is made sure that all of the people providing proposals were qualified to do the work, so that once it came down to pricing, it wasn't a matter of low bid and the person not having the qualifications. All of the entities had the proper qualifications. That's why the committee decided that we would look at the price then and see where we came out. I think Bill did a really good job with this. And he and I have had conversations that this is really the process we would like to do moving forward is select qualified candidates and then have them present. Just even though they're professional services and it doesn't have to be bid, we want their price quotes as part of their proposals going forward so that we can take advantage of savings when they come in.
Yeah, I agree.
I think it was really that's a good process moving forward. I thought Bill came up with was really good.
Yeah, thank you, Bill.
Yep, you're welcome.
And hopefully other prices will come down in the future instead of this company raising theirs. Anyways, any other questions? Then I'll entertain a motion to approve the proposal. Your area, Mr. Stevens.
Motion to accept selection committee recommendation for SH22 engineering design services and award Finney and turnip seed in an amount not exceed $79,200.
Second.
Have a motion and a second. Any further discussion? Voting.
Aye.
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 Commissioner Cos votes aye.
Commissioner Shinky votes aye.
Thank you.
The second board action.
Good work, Bill.
Oh, yeah, thank you. The second board action item for your consideration today is a agreement with KDOT for the signage grants that were received this year through the High Risk Rural Roads Project and the KDOT Local Projects Bureau. Many times these grants that are received, other than signage grants, are either 90-10 with 10% local participating funds or 20% local participating funds. This actual agreement does not require the county to participate financially in this project, and so this agreement, for lack of a better term, is just our obligation to fulfill the requirements as the local project administrator for the project. We will attend the meetings, we will participate in the design process, we will adhere to their schedules, and we will act accordingly if any right-of-way or easements had to be acquired, which they shouldn't on a signage project. So it is not a financial agreement due to the type of the project that we did receive funding for. It does have to be signed by all 5 commissioners and attested by the clerk.
Okay. Man, that E58 area is getting some upgrades.
Yeah.
New signs,
It's about time.
new bridge.
Yeah, I should have said that. It is for County Route 13 and County Route 14. The northern.
It's a long time coming. Been kind of neglected up in the north end the last 20 years.
I'll entertain a motion then.
I move we approve the contract with KDOT for a high-risk rural roads signage project.
Second.
Have a motion and a second. Any further discussion on the contract? And voting.
Aye.
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 Commissioner Cos votes aye.
Commissioner Shinky votes aye.
Thank you.
All right, thank you guys.
We'll start looking like south end of the county pretty soon.
Yeah.
Might be a minute.
It might be just a minute. All right. I guess we're ready for discussion regarding mask requirement. Mr. Miller?
This is Commissioner Cos.
Go ahead.
I asked for the mask issue to be placed on the agenda because, in retrospect, I feel that we may have done a disservice to residents of the county on the 2nd of July by not fully educating the public as mandate was unnecessary from a public health perspective, and the criteria that was used on whether or not to make a recommendation to support the governor's order. It was not, my intention was not to bring the matter back up for a vote. We just to have a discussion and educate our community members from both sides that there is a potential at some time in the future any issue regarding the pandemic could be revisited because of the request from the public health officer and that we didn't just willy-nilly make our decision.
Vicki, could you repeat that?
We just had trouble hearing you.
We didn't hear you.
Oh, you didn't? None of it?
No.
Your phone is cutting in and out a little.
Oh, sorry. I just wanted to say that I asked that the mask issue to get placed on the agenda because, in retrospect, I feel that we may have done a disservice to the residents of the county by not fully educating them as to why the mandate was unnecessary from a public health perspective. And I think that we needed to kind of let them teach them or give them information to understand the criteria that the health officer used to arrive at that decision to make a recommendation that the masks were not necessary for our county.
So, before you answer that, could I ask the county councilor? We have a executive order from the governor. We have an executive order from the governor yesterday dealing with mask requirements for public schools. Can you tell me, or maybe you don't know, and we'll have to get back to us, but can you tell me what authority the counties have as far as that executive order?
Commissioner Stephen, I would ask Tom to actually review the order and as to how it applies for any interface between the school districts and the Board of County Commissioners. I am going to offer the initial presumption that the State Board of Education and the local school districts may be outside of your jurisdiction, but I'd need further time to look at that.
All right, thank you.
Jamie, what's the green line and the?
I'm going to talk about it.
Okay. Got it.
Okay, go ahead.
Morning, Commissioners. Jamie Miller, Health Officer, Health Director, Leavenworth County. Real quick, I just want to give the update of where Leavenworth County is on statistics for, and then I'm going to talk about briefly just what I handed out in regards to the other statistic that you're referencing. Total as of Monday, there was 1,285 positive cases. Of that, 369 were community cases. Of that 369, we had 97 active cases that the health department is currently monitoring. We had 8,235 negative cases, 2 hospitalized. In a total of 41 of that 30 are community hospitalized. 11 of those were inmates out of those inmate numbers when we separated them. We had a total of 3 community deaths and 4 inmate deaths. Over the last week or so, I began adding ages, if that is something that the community has asked about, so I have added that also in as a statistic on our weekly kind of reports that are going out. The document that you were referring to, there's 2. I kind of mirrored it off of Douglas County, who has a mask order and is also putting a mitigation step of closing their bars shortly before 4th of July to show positive 7-day moving averages on positive cases. The green line on the bottom that you're referring to, Commissioner, I started that in June going through current day. That is just our community cases that we added. I pulled out because the blue line is our total cases throughout the entire process. I wanted to show what we are averaging on a kind of 7-day average just on our community cases and what we're doing testing as we don't have inmates currently in those numbers to show how that is not impacting. You can see since May 4th, we have been on a pretty steady trend down because of the amount of testing into positive cases. We started in June at about 18.9%, almost 19% positive cases total, and we're down to 13.36, if you will, currently. But if you look at why I want to show local, this is what I was looking at when we went to the mask order. When we had the mask order that was placed in front of us, we were on a downward trend from a 9% in about mid-June to about the 4%, 4.8%
that we were on a downward trend there in July. Since then, over the last few weeks, obviously caseload has began to increase, so is our testing along with that, but we are still on an upward trend. As of last week, we were at 5.39, and currently we're at 7.6 on Monday. And what it looks like from yesterday's numbers and then going into today's numbers, we're at approximately 7.31%. So we're still on that upward tick just on our community cases on percentage. So I thought it was important to show, if those look at KDHE's website, yes, it will show that we're at that 13.36 mark in regards to positive cases, because it's usually the total cases that are assigned to our county. And again, 849 of those are inmates, 67 of those were Grossman Center. And I really want to be looking at our community cases because, again, all of those have been recovered. What we're looking at now is I want to be looking at what's active and what we've been testing over the last 60 days, because that's really going to be our site picture for what direction we need to go. The Douglas County one I just forwarded it and wanted to share with you to show how Douglas County was faring early on, and then the uptake that began. As you notice, when they hit their 12%, that's when the mask requirement, which is really that 10% mark, is that really that key factor. They put their mask in place, and then they also, when they hit the 16th mark, they closed bars. So, which is that 15%, they needed another mitigation strategy. And what they were finding also in Douglas County was a lot of cases were being contact traced back to bars and social events and mass gatherings, so they put that into play. 2 weeks following that, you can see the downward flattening, if you will, coming back down based on those mitigation strategies that were put into play for Douglas County. Because I wanted to be able to show that, so we had actual factual evidence to show that when you put a mitigation strategy, what does that look like and how does that play in, and why what I have been looking at also and trying to monitor all along. We were way up at that 25% mark, and quite frankly, at the 25% mark, there should be large strategies in play. But again, because those were not community driven, we did not put those into play, and we were really still looking also at community strategies and what our community numbers look like. So that's why I added the green on the bottom of ours to show that as well. I think that's a lot of data in there that can help us understand what direction, why certain recommendations were made, and why we were going in that. I did have a conversation with the medical community and medical director yesterday, and I can tell you that the medical advisor, as well as the other physicians in our county, would like to see masks as a mandate, even as of now, because we're seeing that uptake, and we don't want to wait, because we know that if we wait for the 10% mark, you're still 2 weeks out. You're going to see a large influx of cases over those 2 weeks before you're ever going to see recovery. And that Douglas County is an example of that, and now we have factual data to show that back in mitigation strategies. Now, again, they did have two mitigation strategies in there. One was closing actual establishments down as well as math. So we're not asking for that, and we're not recommending that, but the medical community out there is asking for masks to be worn. Really, in the Kansas City Metro, speaking with other health officers and health department directors, there's three strategies that we have available to us right at the moment that are not impact to, if you will, the economy again and shutdowns and things of that. It's washing the hands, social distancing, and wearing a mask. Those are the three simple things that all community individuals can do. It is something that science is out there now for a mask, that it is proven that it will reduce the spread. It is an inconvenience. We're aware of that. I've been wearing a mask now since March, so and out at our offices. But again, it is a strategy that I think is easy enough for our community to abide by. Now, with that said, I'm also pleased that in the last week, many large box stores and businesses have announced that they are implementing mask requirements. We know of Walmart, Home Depot, Aldi's, Kroger, and there's many more that have been put on the list. More and more are going that route within their own stores in requiring masks. So even if the county isn't pushing that, our business sector is pushing that because they can also see the benefit to their employees and risk reduction of their employees also being exposed and sick. So I just want to talk real briefly, though, on outside of masks, what the big problem we're seeing from the health department standpoint with the community is, and that is individuals not quarantining and isolating when they're given those orders or they are talked to and educated also while they're awaiting their lab results. We have individuals that will come and test on Monday. We call them. We're about 3 days out. We'll call them on Wednesday with those lab results. And they say, oh, well, I didn't think I was going to be positive. I was at this place, this place, this place, and this place when they should have been quarantined all the way until those lab results have come back in further instruction. And then we have the exposures. So we're also seeing on contact tracing large household units being infected and exposed when we're having parties and graduation parties and 4th of July gatherings and things of that nature. About half of our cases over probably the last 2 weeks are family groupings, meaning mom, dad, and children all within one household, and they were all at a party or they were all, and then we go to the next family, and within that family it's connected back to this party or this gathering. So we're seeing a lot of that style exposure than we are even from the any sort of box store exposures or things of that nature. We're actually seeing them at very contact isolated instances where we can contact trace it back to where we believe all of these have the same exposure point. So those are some statistics that I wanted to talk about today and kind of give the board that brief as I was asked to come up and visit with you. I'll entertain any questions you might have.
So on these exposures to these large gatherings in private homes, I mean, they wouldn't have been wearing a mask anyways, probably.
Correct. And also when we do those interviews, obviously at the graduation parties or event or wherever it is, when asked were masks being worn, we get the general answer as of no, they were not.
Can you reflect on what positivity means, like how the number of tests impacts our positivity rate, and where our number of tests are now as compared to March, April, May, and how that really impacts the number of cases that are
sure.
outlined?
And why we use percentage of positives is because what that does is that then takes in the equation for when we hear the terms, well, more tests are being done, so of course you're going to see more positives. Well, it's also based on percentage of testing that is happening to the amount of testing coming back. So regardless of the amount of testing, it's the amount of percentage positives coming back is what's important based off of those test results. So I'll give an example. Why I put on there on the bottom on the green is where we are testing on Monday, we were at a 7.6 positive rating. We had 33 cases, but with that, we also went up 400 and whatever that is in number of tests for that day as well on that. So yes, we added 33 positives, but only 7% of those positives was to the total number. Am I answering the question exactly?
So for example, if there's 400 tests done, and that's the denominator, and there's 33 positive, that's going to give you a different positivity than if you had like early on, we had like 100 tests going on or 50 tests going on, and so while you have a higher number of cases, you have a lot more tests
conducted. Correct.
Any other questions?
I was just curious, Jamie, this is Commissioner Cos. Why doesn't the health department include the Fort Leavenworth statistics on our reporting?
DOD does not allow me to report out any of their numbers. They are considered their own, lack of better terms, their own public health. They have their own public health, so they have their own numbers assigned to them. And I don't have access to their cases, so I don't have the ability to look at their cases anyway. So I can't really report out on accurate numbers. One of my biggest things that I pride myself on is I am only going to report out on numbers that I can verify. And that even goes, I've argued a few cases over with KDHE that were individuals that may have been in our hospital for a day and then they were transferred, but they didn't live here. And so I only want to count numbers that are our residents, our numbers. I can verify, and we're tracking them as active cases within Leavenworth County. And I cannot do that with Fort Leavenworth. There are DOD regulations that also do not allow me to put out any sort of numbers for Fort Leavenworth.
Right, and I understand that, but they do report to the state, correct?
They do report. From my understanding, they are reporting numbers into the state, and the state is working with them. But again, I don't have access to their cases.
Well, I was also trying to give a bit of an explanation as to why some of our numbers locally might differ from what is showing up at the state on the state site.
Commissioner, you're breaking up. I can't.
Oh, I'm sorry. I was just trying to clarify that oftentimes if there is also a discrepancy between Leavenworth numbers and the state numbers, it could be that the state is reporting out generically Fort numbers.
That could be the case, Commissioner. There's also the USP that, again, doesn't always, being federal, does not always report in numbers. They don't have to report numbers into the health department specific, and at times they may report into KDHE late, or it may be at different points in time. So, again, numbers that I'm reporting out are our community numbers that I can verify that we can actively have those cases.
Thank you.
Can I ask a question?
This is
Go ahead.
Commissioner Simke.
Yes, sir.
You gave our example of over 400 tests administered and number of positives as a percentage.
Correct.
Those are, well, what I hear in the private sector still is one, ability from their, primary care doctor as to whether or not they'll allow them to test. But is it fair to assume there's still cases being confirmed that are not being tested, meaning you have somebody that's home, they're saying they have the symptoms, they're basically self-diagnosing, and their primary care is saying they're positive, yet a test is not being administered. Can you share any insight on that? Because I know that was something that was happening quite frequently early on.
There was a lot of probable cases that were, because testing was very limited and could not be conducted to as widely as we are now. We are not, we are testing. That is one of the big things that Leavenworth County Health Department is doing. We will push for a test. I will not count a probable case if we actually, as of right now, the state on the state website says that they have 2 probable cases to us, and quite frankly, I don't put them on the confirmed positive. Now, that's not part of my spreadsheet for confirmed positives, because my confirmed positives are PCR tested confirmed positives and not probable cases.
Which makes sense, and I agree with, and thank you for doing that. My concern is what the hospital is doing.
Yeah, there are other. Wyandotte County on their website does list out separately how many probable cases they are counting. Some of the other websites that are out there within our metro are also putting their probable cases on. But again, I'm looking at confirmed positive cases through PCR testing. I think that is what will help us. We know there's many cases out there that are going untested, and I'm not reporting on that as well. And that was one of the about the first 2-3 weeks in, we started removing probable cases off of our as a confusion source to a lot of people, and people wanted to know true numbers. So our true numbers were the probable cases that we can laboratory confirm test. I will also say there's been a lot of confusion, and people believe that we're counting positive tests multiple times for the same individual, and that is also not the case. We are testing people. There are individuals that have tested multiple times, and once you're a positive, you're counted once as a positive. You're not counted multiple times as a positive and put back onto the active list and such as a positive that continues.
On the national, go ahead.
Sorry, Mike, I just wanted to confirm. So, again, the concern based on feedback that I have received from individuals with their primary care doctors, whether that's in Leavenworth or in an adjacent county, is they're being self-diagnosed to some degree, and that's being reported somewhere. And I'm only suggesting that, again, using your data, which in a lot of cases that's the only thing I trust, is saying that 5%, 6%, 7% of those who have been self-diagnosed and or that ultimately get tested are positive. And that's a big variable to use all of one group as a self-diagnosed versus test administered and what the actual results are.
Yeah, and in our numbers, Commissioner Shimke, are laboratory confirmed positive cases. Those are not probable cases. They are confirmed positive.
Understood. Thank you.
On the national level, the cases have trended younger. Is that also the case in Leavenworth County?
We have, I have over about the last 2 weeks, have started to see as more families and children are starting to be tested. Children's Mercy is starting to test more. For a long time, Children's Mercy was not performing tests unless they had multiple symptoms. They were going to be hospitalized, and then they would perform the test. We tried to perform as many children tests as we could early on because we had the availability to do that out of the health department. We have been testing more, and I envision that our numbers are going to start increasing as more children start being tested in these family groups. Parents are starting to have more concern in getting and allowing their children to be tested. We're seeing positives. Now, the advantage, a lot of our children are still somewhat asymptomatic or very mild symptomology is what we're seeing in a lot of these children. But we don't have a whole lot of data on children yet. But yes, Florida is a prime example of children and how many children were tested in Florida and how many of those were asymptomatic and came home positive.
So if it's trending younger, the severity rate is also trending down.
Well, that's what again is what I was saying is we didn't have data on testing children before, so we don't know how many children, even throughout the months of March, April, May, June, and most of July, already may have had it, have been exposed to it, because we weren't testing children at the rates that we're currently seeing testing being performed on children.
But children don't tend to get this nearly as severely as a senior citizen or some of the pre-existing.
Currently.
And that, I think that's some of the when you take all these things into account, and one of the things is we haven't had a. Do you recall the date of the last death we had in Leavenworth
I don't
County?
know the exact, but I believe, Commissioner, it was back in May.
So we haven't had a death for a very long time, and I think, when you take, I'm thinking keeping all of the numbers in perspective is one of the things that we lose track of here.
Now, when a business has somebody that doesn't wear a mask in their business, who do they call that has a requirement?
They can call law enforcement on that because that is their store policy.
Mm-hmm.
And again, I would refer to county counselor in regards to, but from my understanding, correct me if I'm wrong, that if a store does not wish to allow someone to come into the store because they're not complying with their store rules, they can issue a no trespass at that point in time.
And there hasn't been a lot of that.
Commissioner Codd, I think that we probably also need to emphasize that just because at the current time there is no mask order in place by the county, that doesn't translate to individuals who choose not to wear a mask have a right to enter any facility that they choose to. That is, if there is a policy in place at the store, that consumers have to abide by that policy.
Okay. But they're not calling the health department, loading up your lines.
We do receive some phone calls, obviously, over about the last week with Leavenworth City Commission bringing the mask order up on their agenda as well as this coming back up on the agenda. My email box has been full. I'm sure yours has been full as well. Again, on both sides of the topic. Although recently I have probably seen the pendulum shift a little bit more towards the individuals being more apt to why don't we have the mask order? Why aren't we having the mask order out? Is being more of what I'm starting to see as it goes. As the businesses are starting to pick up on the strategy of having masks. So again, like I said, I also had phone calls. I did visit with the medical director as well as the medical. She visited with a lot of the medical physicians throughout our community, and obviously the recommendation is that Leavenworth County should be under a mask order. So again, our numbers are starting to trend up, especially over the last 2 weeks. I am fearful that if they do continue, because we are testing more, we are getting more positives. With more positives out, that means more exposure is going to be out, which means there's going to be additional cases, which is going to continue that pathway of our percentage can exceed that 10%. I don't think it is prudent for me to sit back as the health officer and say, let's just sit here and wait until it hits that 10% magical moment. So again, I can tell you that over the last 2 weeks we are trending in that direction, and if it continues, I think we'll be at 10% before next week. And if we don't get into having more individuals in our community in mass, social distancing, and washing hands, it's going to continue, and we're going to have individuals that will be infected, and again, the infection can affect each and every person differently, and we need to. It's the obligation of myself to inform the board of the recommendations.
Any other questions, Mr. Miller?
Well, I just wanted to say I'm using your information, Jamie, and I'm not seeing it the same way. You're the health director. I'm not trying to argue with you, but your numbers, your information says we are down from May 4th to today, almost half as many. And locally, we are down. The numbers are down from June 22nd locally. So the trends are down. Now, we had a 4th of July weekend in there, so this uptick you're talking about anybody can see that's clearly a result.
May 4th, remember, Commissioner, on May 4th, we had not only the LCF, but we also had the Grossman Center
Right.
In those numbers, which, again, when I went in and tested the Grossman Center, we had 75%, just out of the Grossman Center total people in that facility testing positive. So that exponentially picked our percentage of positives up to that 25% mark.
So then the green line, though, if you take that out.
The green line, again, is where we based, we were at 3.8, 8.6, 9 point, but again, if you remember, during the months of June, caseload was down considerably. We were at 100 for 2 days, and maybe 1. Caseload was way down. Our testing was way down also during that time frame. So again, when we were hitting a positive, our positive rates were at 8.6, 9.4 on those weekly moving averages, which makes it look like we're elevated there. If you look at the trending line in just since the week of 7/6 going to 7/20, we're starting to go up on that peak. And my concern is I'm also monitoring Douglas County. Douglas County was 11.93 on Monday. Wyandotte County was 17.1. Johnson County was 6.1 on Monday alone. And we're at 7.6. So we're in those trend lines, and look at all of their numbers also on what their trendings are for those 7%. What I'm fearful of is if we don't motivate early enough, we're going to be behind. It'll be a 2-week catch-up period, just as you can see on the Douglas County, to watch it finally start impacting and bringing those numbers back down.
You don't think the 4th of July weekend celebrations had anything to do with skewing these numbers?
I think we did for up to the 14th. We were seeing that. That's your incubation period for anything that happened over July 14th. We're through that incubation period. So what we're seeing now are, like I said, graduation parties, events, different things that we can track a lot of our cases back to some travel. We have a lot of people that are still doing vacation travel to areas that, quite frankly, are hotspots around the country, and they come back and they're positive when they come back within that 14-day window, and we're testing them. So,
is the goal to public health goal, and you talk to a lot of public health officials and doctors and such, is the goal now, early on the goal was to break the curve, so we had enough, if there was a rush on the hospitals, we had facilities and we had beds. Then now we've moved kind of beyond that. Is the goal now to, is there a magic number where we're saying, just the fact that you have more cases, if you look at herd immunity and do we not actually want to have more cases in the long term? Because you want to reach a certain level where you build the immunity, don't you?
You do on a safe. If you look, I just was reading, Dr. Norman put out some information last night about the Sweden, what they're dealing with right at the moment, and how they were very loose and very liberal on we're not closing things down. And it was actually, they're coming back now with their caseloads and their deaths and things are shooting through the roof, and it's not actually, they did not get to herd immunity. And to get to herd immunity, you're going to have a lot of deaths to get to that point, because you're exposing a lot of people that also will not be able to deal with the virus. And I'm not saying we're not going to be able to eradicate this virus. That's not what any of these mitigation strategies can do. What we're trying to do is protect the vulnerable and those individuals that we don't want them to be exposed to the virus. And the only way that we have on the public health side right at the moment is washing the hands, social distancing, and wearing a mask. Wearing the mask, the reason for wearing the mask, and you and I have had this discussion before, wearing the mask that I'm wearing right now is to protect you and everyone else in this room. It is not for you, as you're sitting there without a mask, if I were to get close to you, you can still have your droplets, and yes, they will potentially come through my mask, and I can be infected. Even as you sit there, asymptomatic, feel fine, you may be positive. We don't know that.
Right, but the initial recommendations were that if you could maintain your social distancing of 6 feet,
Correct.
and the World Health Organization says 3 feet, but the CDC says 6 feet. If you can maintain that, then a mask is just an additional mitigation.
Correct.
But and when you get into like our kids at school coming out and going to play soccer, or they're going to play basketball, and all of these, you know, whether we're going to be able to do that, and we're talking about the governor's order, you know, are we have to get to a point where we decide as a community, are we going to just shut everything down because of the risk of people having cases, or are we going to allow our society to open back up? And one thing I was going to bring up, you know, I think so many of these things are not keeping perspective, and we've talked about this before too, is we had 1,150, 2019-2020 flu season, influenza and pneumonia-related deaths in Kansas were 1,150, a little above that. And so far, the COVID-19 since we started counting in March, I believe, or maybe a little before that, has been what? We're at 300 and so if you multiply that, we're actually more than 4 months. I originally was saying multiply that times 3, but we're getting to the halfway point. So it looks like we're not even going to have the number of deaths from COVID-19 that we had in the 2019-2020 flu season. And then I read this article from the Journal of the American Medical Association, and they were citing the number of deaths expected in Kansas in a 2-month period, April and May. And they cited 4,200 deaths in Kansas in a 2-month period. So if you go monthly, that's like 2050. And then they have a statistic on what's the number of excess deaths above what we would expect. And that number is 121. And of that 121, they say 84 can be contributed to COVID-19. So I think you've got to keep all these figures in perspective when we close the whole world down and we close the economy down and we try to mandate masks, and I just think we lose perspective on the numbers we're talking about. The numbers are not that high when you compare that we have 2,000 people in Kansas die every month. And for us to impose a order and a mandate on people with that type of a percentage, I mean, I just feel like, and believe me, the phone calls and the emails, we believe in masks, and we have a recommendation from your office that's on the website, and it fully supports masks if you can't maintain your social distancing. But to have friends and neighbors at each other's throats and people calling and reporting their neighbors that you weren't wearing a mask, or this is the type of a problem that the reason we don't support mandates is because we're going to get into all kinds of enforcement problems.
Well, and passing one rule for the entire county to me doesn't make sense, because it's just like the governor passing one rule for every county. You got western counties that don't have any sickness at all in Johnson County, so one rule doesn't work. At the county level, if the cities want to pass an ordinance, that's fine. If the businesses want to pass a rule that you have to wear masks, that's fine. But I don't think one rule for the entire county works very well when you've got a rural area versus the urban areas. So we're recommending masks,
Right.
but if the cities want to pass it, that's fine, and if the businesses want to, that's fine. But I don't think people are catching it as much out in the yard mowing hay as they are in town. So I don't see how one rule is going to work.
And what days did businesses start requiring masks? You know, like Walmart, and you said the list of businesses you said. Has it been a week
I know
yet?
Kroger started, I believe, today.
Okay.
A lot of them, I believe it was this week. There's a lot
This
of
week, so we haven't seen any results yet because of that. but I wear one when I go into them places. I always wear a mask. I think when I go to Walmart or Home Depot, Tractor Supply, where else do I go? O'Reilly's, I went in a couple times without one because there wasn't anybody in there. But I carry them, I wear them. I think everybody should wear them when they go in places like that. So you don't know how you're going to be able to, if you're going to be able to social distance from someone.
Doug, I had this is a document, the interim guidance from the World Health Organization, and it's dated June 5th, so it may have changed. This is the latest I could find online. But one of the things that they said in here is that at present, there's no direct evidence from studies of COVID-19 and in healthy people in the community on the effectiveness of universal masking of healthy people in the community to prevent infection. And then another thing they cite in this report is one potential problem with it. And if we were going to implement a order, I think that the groundwork should be laid for it. We should have a process and roll it out. That's one thing I had a problem with the governor coming out 2 days before the 4th of July. I thought we should have rolled it out and had a process. But one thing they say, the World Health Organization says that a mask can offer a false sense of security leading to potential lower adherence to other critical preventative measures such as physical distancing and hand hygiene. So, and I see it at the railroad all the time because we have requirements in certain buildings and in vans. And what I see is these being put into train bags, and then when you're going to go out and get in the van, we quickly pull these out so that we comply with the rule, and we get in the van, and then we put it back in our train bag, and it doesn't get washed or cleaned. And that's a public health problem. And so if we were going to implement a mask order, and I think we should definitely give it, like if you were going to implement it, I think you should say, in 2 weeks, I want to implement a mask order, and I want to roll it out, and we want to have parameters and teach people how to properly use masks. Because I think it's a problem.
There's enough education out there already, and there's enough studies. There's been over 172 observational studies across 16 countries and continents that are showing the statistical scientific data on masks. There's enough evidence out there that will everyone wear a mask appropriately? No. Will everyone wash their mask appropriately? No. It is public health. We have been from the very beginning, if you remember my very first order, it had masks in the very first order in regards to wearing masks, and that is a mitigational strategy. That has been public health stance all along. It has been ramped up as additional statistical scientific data has been. I don't remember exactly what date you said on that, but there are plenty of studies out there in the very, very near past that have shown what a mask can do in slowing down. It's not going to stop it. It's not going to eradicate it, but it is going to slow down. And again, you don't have, when you are going to implement a mitigation strategy, which we already have, we've already said everyone should be wearing it. It's recommended everybody should be wearing that mask. What we haven't said is everyone shall be wearing the mask. So if people are going to buck already against the system to wear a mask, even if we put shall without enforcement, it's still not going to put a mask on everyone's face. And I realize that. I realize the issue, which was also played into the last time I was in front of this board, saying why it's a high recommendation. Because enforcement, I don't have the staff, law enforcement doesn't have we know cannot go out and really enforce this. So it is a community buying into, again, masks. And I'm here to just, again, brief the board that the medical side, our doctors in our community, my medical director that I'm listening to, this is not Jamie Miller specific up here. This is the medical community. I am the voice for them right now, saying they believe that a mask enforcement, just as our surrounding counties are, we should be included. That's what I'm presenting to the board today. I'm not here to argue my opinion, whether I think it is or isn't. Scientific, here it is. This is what our medical director, as well as our medical community, is saying to this board. It is ultimately now with, again, House Bill 2016. It puts the Board of Health the ability to say, no, we're going to enforce this, or yes, we're going to enforce this. It's my obligation, I feel, as the health officer, to sit and present all the facts. I have given all the facts, numbers, any literature. I will answer any questions that I can answer. But again, when it boils down, it is this board's decision whether you want to enforce that or not enforce the recommendation. I am here to tell you what that recommendation is.
Yeah.
And so has your recommendation at our last, when we met before, was to maintain the recommendation status. The question is, what have the parameters so changed and have the numbers so changed that there's a justification to change that recommendation?
Again, with the caseload in percentage of positives is changing over the last 2 weeks on the average, that we are on the uptake, the recommendation, and what the cases we're seeing in counties around us, what the hospitals are seeing around us, from the medical community, that's what they're coming back. They're the ones seeing these patients, and we're the ones that are having to be in contact with the patients that are ill and calling in, and we're seeing what the exposure rates are. And I can see again, we're at 97. I think my last look before I came in, there's going to probably be an upwards of plus 16 or more again today. I don't know what the percentage rate is because I don't have all the data for today's numbers that are going to come out. We can understand that even based off of that, we're right now 1 in 66 people in Leavenworth County have had COVID, just based off the 1,285. So we know what that's going to start expanding on, and we can think of what that may look like in 2 weeks. I think that's where the medical community has made their recommendation to me, saying, this is what we would like to see. I'm presenting what they would like to see.
I guess I'd like to have them come up in front of us and go more specific into these numbers.
Hey, Mike, this is Commissioner Timothy. Jamie, I think we're reading you loud and clear and are very appreciative. There are obviously lots of numbers that are still impossible to validate, as in, how many people had already been in contact, had it, and recovered before measures were taken in March, right? But Mike, to your point, you're not going to get the medical community to do anything that isn't prevention of loss of life, no matter what. It doesn't matter if it's one. If it's one, it's too many. I don't think anybody can sit here and say that a mask isn't helpful or won't be helpful against the common cold or the flu or any other airborne illness. I think everybody is in agreement. It's to this point of common sense, which I think is becoming less and less common. To Jeff's point earlier, you got somebody cutting hay. I see people all the time driving by themselves in a car with a mask by themselves. To each his own as far as making those decisions. But I think we have to realize that the medical community and political or otherwise, you have to think about communities like New York. You have to think about LA, Detroit, Chicago. Very rare, in the Midwest is the commute other than a person in a singular vehicle or a person going up the stairs. If anybody wants to jump on an airplane every day or in a subway every day or in a train every day, that all looks very different. This goes back to common sense shall prevail. There's a big difference between a business that sees tens of thousands of people a day and one that sees several, where social distancing can obviously be implemented, where you can keep your distance from somebody and where you can't. So, again, trying to make a one-size-fits-all, whether it's 105 counties, or comparing a Kansas City health system to one of New York, which there is no comparison. If anybody's done their research, they'd understand that Missouri and Kansas per capita have more medical resources and beds than any other state does. And so, for some of us, it's very difficult to forget the very beginning of this, which was to slow. And Mike, I think you mentioned curve. And we can continue to do so with good common sense, which is social distancing, washing your hands, and doing all of those things. Can't be a mask makes a lot of sense, and it's a great mitigation tool. But again, trying It's not one size fits all, and I think we're also on agreement of that.
And I just want to touch on, Jamie, I appreciate what you said about the adjacent counties, but Platte, Atchison, and Jefferson do not have a mask order, so we're stuck right on the
Did you
line.
say Platte?
I don't think Platte does, do they?
Platte isn't a mask.
Did they? Okay, but Atchison and Jefferson
Atchison
don't.
isn't a mask.
Atchison is a mask?
They're in a mask.
Okay, what about Jefferson?
So we're Douglas, Johnson, Platte, Wyandotte, and Atchison all around us are.
Jefferson's not.
They're all in mask orders.
So we're right on the line, and so watching the numbers is the smart thing to do, and that's what I think we should continue to do. And what I see is we're down from May 4th and we're down from June 22nd. So the way I see it, until it goes up, we'll watch the numbers.
How long will it take to see any results from these stores that are, will it take 14 days or so from the time you do to see if it's...
From the study so far that we're looking at with entities that have seen the swoop, and then where they come in and said this is when the mask order, this is when the mitigation strategy, just like Douglas County. And that's why I gave that, because it's a great visual on that. It shows the 2 weeks that it took to watch that start coming down. And again, it continues to drop, because like I said, on Monday they were at 11.93 or whatever they were on Monday. So they've come up, they shot all the way up over 27%, and now they're back down to 11 just in those 2 weeks. So again, they implemented 2 strategies. So they did some closings of establishments, and they have some other things in their orders about gatherings and such. So they have other mitigation strategies as part of what's going on in Douglas County. So I can appreciate it's not apples to apples, but it shows that mitigation strategies do work, and it takes about a 2-week time frame to see the results.
So with all these businesses requiring, we should see some results.
We possibly could, just because, again, government didn't put it in. Businesses are taking it upon themselves to implement some of those strategies. But what we also need is the community to also utilize what tools we have available to ourselves in our community, which again is hand washing, social distancing, and masks. And I will continue to push that, because again, that is the public health side answer for what we can do to mitigate and reduce exposure to our community.
Jamie, Commissioner Shinky, quick question. I'm kind of curious what has driven the surge of testing. Again, I'm a proponent of testing. I'm not going to talk about the quality of tests or questioning tests, but in general, testing is a good thing. Any idea what's driven the numbers up? I mean, we've gone circles and circles around how 80 or 90% of the people that ultimately test positive are asymptomatic.
Right.
So what's driving more tests, in your opinion? Because if they don't have a fever and they don't feel like they have it, I'm surprised to see hundreds of people.
A lot of them are.
It's good.
It's contacts, Commissioner. A lot of them have come back because they're aware that they've been in contact with someone, or someone within their home was in contact, and then they test and they're positive. So, and then in turn, within the 14 days, more symptoms pop up of those in the same household. So the testing, and we do the confirmation of those that live within the household, testing. But a lot of it is, as the number of individuals came forth with some symptoms, it started to drive the number of cases up, which drove then the contact tracing, which drove a number of other individuals that wanted to be tested up as well.
Have they come out with any new kinds of tests?
I'm sorry?
Have they come out with any new kinds of tests besides the swab up the nose?
The PCR test is still the RNA swab, which is the most accurate test in regards to diagnosing actual COVID-19. They do have antigen testing, antibody testing, but again, there's still issues with the performance and false negatives, as well as false positives with some of that testing. So the PCR test is still what is being pushed to us from KDHE for the most diagnostic for active virus, and that's what we're after, is that active virus, because that's what's spreading into the community. It's when you have active virus is when you can pass that along and expose others, and that PCR test is going to tell us when we have virus there. And it's difficult when they're asymptomatic. That's why it's very prudent that we get them tested early on if they've been in contact to find out, because, again, that's what we're concerned with, again, with masks, is individuals are going in and out of stores or in and out of close contact with individuals, and asymptomology means you have no symptoms, and that is where we're seeing then the spread to others without anyone knowing. And again, the mask is one thing that can be a strategy to help reduce that, is what we're after.
So I have a question on sports for school. What is your recommendation as far as?
I don't have one yet.
You do not have a recommendation?
I do not have one yet.
Okay, so that is that being worked on by the state, or where's that coming from?
There's information being shared amongst health officers, amongst health directors, amongst the Board of Education. We're all because again, one shoe obviously cannot fit all. Caseload. We have to look at. There's all sorts of different things that have been talked about in regards to what sports are going to look like. They've talked about all sorts of different variations across the state, flip-flopping different sports at different times that are more non-contact sports to do early on, so you can have some sports happen. There's been all sorts of different recommendations.
Well, I've heard a lot of conflicting things about if you're playing soccer and you're going to have a mask, and it's and from reading this World Health Organization report, they go into specifics on masking and what there's a lot of public health issues to masking that are going to have to be considered, because if you don't do it right, you can be infecting yourself with other things. And certainly with our kids, that's a concern.
Probably going to have trouble getting refs and substitute teachers this year.
Yeah, I mean, and like I say, when you go to the numbers, you look at the numbers of what we're talking about, the numbers, and we're closing the world down for these very, very low numbers.
That's the problem, the balance between bankrupting everybody.
I don't think that Jamie's asking that we close down the world.
Well, I wasn't specifically referring to Jamie. I'm referring to this whole situation. I mean, if you look at what's happened.
That's the balance.
Well, again, Commissioner Stinky, just want to go on record. Jamie, thank you for everything you have done, are doing, your team, and everybody else that's involved, obviously, for a community to try to impact something that is largely untraceable. It's an incredible task you've taken on, so I appreciate all you've done.
Thank you.
This is Commissioner Paz.
Go ahead.
Okay, I was making sure you could hear me. It should come as no surprise, but I will reiterate that I have committed from the beginning and will continue to do so. I support the recommendations of our local public health officials.
Okay. And I encourage everyone to wear a mask. I really think you're out in the public and you should wear a mask.
If you can't maintain your social distance?
If you can't maintain your social distance, wear a mask. And like we'll just call them the big box stores or even convenience stores, you don't know when you're going to not be able to maintain it. So.
And I think a lot of times private decision making as opposed to public decision making is even more important, because people by themselves are making the decision. And I've seen in the past couple of weeks, I've seen a lot more people in the context of stores and Walmart and Home Depot, all these stores. I have seen a lot more masking going on, and that's private decision making, which is in many ways more impactful than a public decision making.
Mm-hmm. Yeah. Well. Okay. Any other questions, Mr. Miller?
No, And as much as I hate to say it, Commissioner Simke, again, the common sense element, just to remind everybody, I think it was Commissioner Cos that brought this up. A business has the right to implement a mandate. That's what a business can do. And regardless of our position at the county, that doesn't supersede that business owner, regardless of the size or scale. So businesses, anything commercial has the ability to implement that mandate if they so choose to, and it will be upheld. Again, not to confuse the two, it doesn't mean that because of the county's position, you're able to go into any store of any size or scale and make the decision for yourself, because you also have the choice to shop somewhere else.
Mm-hmm. And if you don't feel safe, don't go.
That's right, and you still have the right to stay home, and you still have the right to not go out. Those are all things that one can continue to do on their own accord.
And a legal question for County Councilor. You're going to research this executive order from the governor. Also, the process would be to change position on the county. What would that process look like? Can you bring that back to us as well? Like if we decided,
follow your question.
Like we exempted the county from the mask order, what would the process be to change that position?
If you have jurisdiction over the schools, it would be the same process that you did with respect to the mask order.
No, what I'm saying is we at the earlier meeting, decided we were going to exempt Leavenworth County. If we decided we were going to change position and go with a mask mandate, what would that process be?
Rescind your earlier action.
Okay.
But Commissioner Simke, again, my guess would be is that a school district being its own entity, no different than a private business. If they implement a policy, they implement a policy.
Mm-hmm. It'd more than likely be up to your local school board. But, okay. So, I guess with your last statement, so you would think that we would monitor that, see what kind of effect the businesses have in requiring masks, and see if that will trend it down?
I'm very, very torn because I want to go along with what the health officer recommends. But I would like to. I actually would like to have the doctors come in here and go through the positivity and go through and actually maybe have a chance to actually visit with them about these other concerns. But I'm very torn.
I'd just like to see if there's going to be some results from the businesses, positive results.
Right.
This is Commissioner Cos.
Go ahead.
Jamie, do you feel that it might be possible to have Dr. McBratney attend next week's meeting with you?
I can certainly reach out. We were trying to, Dr. McBratney unfortunately was going to try to actually come today, but she's the only physician in the office today, so she was not able to come to the meeting at this time. So I will reach out, being a week out, I will see if I can have her come for next week.
Okay.
Thank you.
All right. Any other questions, Mr. Miller? Thank you, James.
Thanks, Jamie.
Thank you.
Do we have any other business for the board? Does anybody have anything to report on? Did anyone attend the fire district meeting?
I did.
Okay. Have anything to report?
It was very well behaved.
Okay.
They had some questions about the COVID funds. That's about it. They're operating.
That's good. Good. Any
Leavenworth County Women's.
Okay. Yeah. Commissioner Cos, did you any phone meetings or Zoom meetings?
I didn't have any. Well, I guess phone meetings. I listened in on the governor's conference call last week. That there's really nothing new to report that hasn't already been reported publicly. I listened in last night on the City of Leavenworth Commission meeting, and they tabled an ordinance requiring masks within the city limits, but they did have a draft to review.
Okay.
And I think that's pretty much.
Okay. I think there's Bayshore City Council night and Fairmount Township meeting tomorrow night. So, if I don't have anything else, we'll motion to adjourn, and we'll be back here at 11 o'clock for a budget meeting.
So moved.
Second.
Voting.
Aye.
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 Mr. Todd votes aye.
Commissioner Simke votes aye.